Hi, I'm Harmony, Head of Partnerships at Family Empowerment Media. We produce family planning radio campaigns that improve health and save lives. Every year, 111 million unintended pregnancies occur in low and middle income countries, leading to thousands of maternal deaths. In sub-Saharan Africa, women face a 1 in 40 lifetime risk of dying from pregnancy or pregnancy-related complications. Access to contraception alone is not enough. Women face barriers, including stigma, misinformation, and lack of information. A lot of women fear that using effective contraception could leave them sterile or even dead. And for many women in low and middle income countries, radio remains a powerful and primary source of information. A family planning radio campaign that was studied with an RCT in Burkina Faso found that it increased contraceptive uptake by 20%. At FEM, we produce campaigns that destigmatize contraception, debunk misinformation, and inform women about their options. Our work has 4 main phases. First, we select locations and co-implementing local partners. Together with our partners, we conduct quantitative and qualitative audience research, and we turn that research into impactful, locally relevant campaigns. And then while campaigns are on the air, we conduct monitoring and evaluation. Zooming in on that first phase, we want to select impactful locations, which are places that have high maternal mortality where our work is needed. They also have sufficient supply for when we drive up demand. They have low enough costs and supportive stakeholders. The first place we worked was Kano in northern Nigeria, and in Kano we could reach 7 million listeners for 9 months for just $63,000 in airtime costs. We then conduct audience research. We've so far to date conducted over 3,000 interviews with women and men in Nigeria to understand their role models, their daily lives, their beliefs, their barriers to using effective contraception. For example, here's a key insight about women in Kano. We learned that non-users of contraception were twice as likely as users to think that putting space in between births isn't that important for health. We also knew that women in Nigeria and Kano tend to trust health professionals. So using that data, we made Q&A and interview shows with medical professionals talking about the importance and value of birth spacing, among other topics like concerns about side effects that emerged from our research. With our partners, we turn all that audience data into really powerful nonfiction shows and also fictional storytelling shows. While campaigns are on the air, we conduct evaluation to ensure that the campaigns are heard and understood and that they're resonating with the audience. We also want to learn, is this driving the final impact of contraceptive uptake among women who want to plan their families? Does it work? An external survey found that contraceptive use has risen by 75% since FEM's work has been on the air in Kano. We're preparing to conduct a randomized controlled trial to evaluate how much of this impact can be attributed to our work, but these results are promising. Since our pilot in Kano, we have gained 2 more co-implementing partners in Nigeria and conducted short campaigns in 11 additional states. We've also conducted proofs of concept in Niger, Benin, and the DRC, reaching a total of about 35 million listeners through short and long campaigns. FEM's cost effectiveness has been well rated by Rethink Priorities, and we've received support from GiveWell, Founders Pledge, and many others. If our upcoming projects are fully funded, in the next 4 years, we could reach 50 million listeners, and our models suggest that our work could avert 250,000 unintended pregnancies. If you want to help women receive access to life-saving information, you can partner with FEM. We are working for a world in which no woman has to die from an unintended pregnancy.